I'd like to share with you a case that we had recently by a patient who came in, of course, who was complaining of this midday, calling it wired but tired, stressed, but in his opinion, when he's stressed, he just feels pretty run down, but he's too wired to rest, if that makes any sense. The test we did for this is called an ASI, and it stands for Adrenal Stress Index, and it's put on by a company called Diagnostechs, and they check, and this test is complex, but one of the major components of this test is called a cortisol circadian rhythm test, and they check that, of course, by spit. That's why they call it a spit test, or saliva test. His results are really interesting. His cortisol levels appear fine, except when you get to midday, between 11 and 1 p.m., they're really elevated. And I'm just going to show you this graph right here, and you could see that the blue, which is where he is, really elevates between 11 and 1 p.m. What does that mean? Well, I'll tell you what it means. It means this person is having a chronic exposure to stress. Obviously, this is the time this person is working, but the stress is really getting to him. And you could tell when your cortisol levels start to rise midday, that's not typical. That's not normal. Actually, it is typical, but it's not something that we would consider normal. So what do you do about it? Well, this person came in for nutritional advice. This person came in for some lifestyle modification. And the first thing we did was we got him on some really good supplementation to really control those cortisol levels. We also taught him some stress techniques and also, as well, helped modify some of the pain he was having in his particular job, which was a lot of sitting, a lot of kneeling. This person was an architect, and it was just putting a lot of pressure on his body. This is a great test when people talk about being fatigued. You hear a term adrenal fatigue. It is tied in with your cortisol levels, which are hormones that are produced from a part of the hypothalamus, which obviously you need to function. But with a stressful lifestyle, poor diet, lack of sleep, even episodes of pain could throw out those cortisol levels and that certain circadian rhythm. There's a lot of information here. If you come in, you have some concerns, we think it's the right test for you, we'll order it, easy to comply with. The results are easy, really clear, and the way to remedy this or fix it is also very straightforward. As always, it's never easy. It's always worth it. We'll help you. We'll figure this out, and we'll get you on your path to greater health. Thank you.